Hello, I'm Jeremy Fernandez. Welcome to the program. The Therapeutic Goods Administration has confirmed 3 more cases of blood clotting likely linked to the AstraZeneca vaccine. Meanwhile, the WA Premier Mark McGowan has placed Perth and the Peel region into a 3-day lockdown following 2 positive COVID-19 cases who've been in the community since the 17th of April. People can now only leave their homes for essential reasons, including work, shopping for groceries and medical needs. Anzac Day commemorations have been cancelled. There's also been some uncertainty around major sporting fixtures, including the Western Forces clash with the Queensland Reds and the Dockers match with North Melbourne. For more, we're joined from Perth by Jessica Warner. Jessica, what do we know about this latest infection?
So as we were hearing earlier today, a Victorian man has returned a positive COVID test after spending 14 days in hotel quarantine here in WA. He'd returned from China, returned negative tests, and he was allowed out into the community on April 17. He was out in the community for around 5 days, and during that time he also stayed with a friend. That friend has now also returned a positive COVID test. So there's a number of locations up on the WA government website now for people to check whether they've been to the restaurants, the aquatic centre, Northbridge, any of the other areas that this man may have been infectious while he was out and about at. That list of people that need to just check where they've been as well also includes Qantas flight QF778. The Premier is urging people to stay safe during the lockdown.
As I've always said, I've been incredibly proud of Western Australia. The response of West Australians has been second to none around the world. We've maintained caution in abundance the whole way along this unpredictable COVID-19 journey. We need to stay the course together.
And of course, it is the Anzac Day long weekend. Many plans have been thrown into disarray, but the Premier is urging people to join in commemorations from their driveway.
Jessica Warner, thank you. Australians over 50 will soon have early access to COVID vaccines after criticism that the troubled rollout has been too slow. National Cabinet met twice this week. Australians over 50 will be stopped from accessing the Pfizer vaccine until the end of the year in a significant reset of the country's vaccination program. The changes to the rollout plan will see AstraZeneca supplies diverted to the new demographic, leaving open the Pfizer vaccine to be used by Australians under the age of 50.
A really good step forward. 1.8 million vaccinations done so far. We're still an island sanctuary in a difficult, challenging global pandemic.
Joining us now is Casey Briggs. And Casey, the government's talking up a ramp up of the vaccination rollout. How fast are we climbing up that ramp?
Yeah, hi Jeremy. Well, we're still patiently waiting to see much of a ramp at all, unfortunately. For about 2 weeks now, the number of doses being administered each day has remained stubbornly flat, about 50,000 on average every single day. And what I think we're seeing is a coming off of doses being delivered through states and territories governments because they have delivered first doses to most of the people in their jurisdiction that they're responsible for. And so we're waiting now for the required period of time for a second dose to be delivered to those people. So this flat daily rate means that we're seeing a pretty linear increase, 1.9 million doses administered now across the country. And of course, Jeremy, this is about the only chart in this pandemic that we actually want to see exponential growth, and sadly we're not yet.
And the situation in India, meanwhile, Casey, looks like it's really getting out of control.
Yeah, it really is. It's a bit of a catastrophe unfolding before our eyes. More than 16 million infections now across the country. We thought we saw a bad peak in September, but it's just been dwarfed by this spike that we're seeing now. More than 300,000 cases in a single day is what we've now seen, and that is the single biggest number recorded by any single country through this pandemic. Remembering, of course, India is a very big country with a very big population. We're seeing similar sorts of trends in deaths, remembering that deaths lag cases, so this spike is unfortunately likely to get worse, but we're seeing more than 2,000 now in a single day, 2,300 in a single day. And we're starting to see changes as well in the makeup of the people that are dying. This shows you the percentage, the share of deaths in Mumbai that are people aged under 60. And what we're starting to see potentially is a bit of a lift in deaths by younger people in India. We'll see if that trend continues. But sadly, it seems, we've known these death reported numbers are an undercount through much of the pandemic, through many countries. It seems like they are a really severe undercount in India, because I want to show you the test positivity rate in India. This is the share of all tests that are coming back positive in the country. It is shooting up. 16% of tests in India are coming back positive at the moment. That is a pretty big indication that they are missing a lot of cases. As cases have exploded, testing has not caught up.
Casey Briggs, thank you. India's COVID outbreak is being described as an infection storm, with hospitals on the brink. Oxygen is running critically low, and a leak in the supply at one hospital led to the deaths of dozens of people. South Asia correspondent James Oaten has this report.
India's a nation gasping for breath. With oxygen supplies at critical levels, every litre counts. Firefighters rushed to this hospital in Nashik after an oxygen tanker burst a leak, but they weren't fast enough. 24 COVID patients on life support died.
There was no oxygen. My mother died in agony. She couldn't breathe. Everyone in the ward died.
The scramble for oxygen has become so desperate that hospitals in Delhi have come within hours of running out. People are wheeling their loved ones from hospital to hospital looking for help. Far too often, there's none available. In the city of Damo, looters stole oxygen tanks from a hospital storeroom.
The looters should use their brains. Doctors, nurses and healthcare staff are working around the clock. We're over capacity.
There's heartache everywhere you look in India as the death toll continues to surge. In Varanasi, funeral pyres are lined up on the banks of the holy Ganga River. Elsewhere, this man in full-body protective gear is performing last rites for his mother.
As a country, we were not prepared. And it's really sad to see my mother go away, because she was just 59. And she recently retired and wanted to spend some quality time with us, but all I could see is lying down on the... That's all I...
Despite the crisis, the government remains reluctant to impose lockdowns.
We have to save the country from another lockdown. I would also like to request states to only use lockdown as a last resort.
Delhi's 20 million residents are in the middle of a 6-day lockdown, but it's unclear what it'll take for that to be extended. The rate of infection here is still at terrifying levels, with 1 in 3 tests coming back positive. James Oaten, ABC News, Delhi.
And joining us now from Delhi is Dr. Vinny Kontru, a respiratory medicine specialist and ICU doctor at Apollo Hospitals in Delhi. Dr. Kontru, thanks for joining us. How are medical professionals such as yourself coping at the moment?
Thank you so much. Thank you so much for getting in touch with me. Actually, it is a very difficult time, both for the doctors and for the patients as well. More for the patients, because we are getting frantic calls that their oxygen is low, they need hospital beds. I mean, a lot of patients calling in the middle of the night as well. So there's no difference between the day and the night at the moment. And we are trying our level best to help all the patients with whatever we can.
So give us an idea of the sort of scale of this crisis that you're dealing with at the moment. How many patients are you talking about seeking your help?
See, definitely the numbers are more than what we were facing last year. Last year at the same time, we didn't have so many numbers and we could still cope with them and deal with them on an individual basis as outpatients as well. This time around, we have a lot of patients who are coming in really short of oxygen and they do need hospitalization. The reasons could be many. Actually, the numbers are so large that even if we say that it's only 5 or 7% of the people who are actually severe disease and they need ICU support. But when the numbers will go up, these 5 and 7% also count a huge number. The numbers would be coming in In addition, we do get many patients from other states of India as well, because we are a premier center here in the capital city. So people expect the best treatment for them as well as for their near and dears. So we are actually the numbers is huge at the moment. Yes.
And how are you prioritising which patients get care over others?
We have to choose sometimes between the more sicker and the younger patients over the ones who have a lot of problems, underlying problems. And we cannot cater to them because they have advanced diseases, they have advanced frailty. So very big decisions, very difficult decisions, but we are trying our level best. Actually scaling up the resources and the infrastructure at such a short period of time when the surge is so much, it's a difficult situation for everybody around the world actually.
In the immediate term, where are the greatest shortages? Is it in hospital beds or in expertise or in medicines?
Well, in terms of hospital beds, there is a shortage at the moment because, as I told, the number is huge. Also, in terms of expertise, because of the fatigue which has set in the medical personnel and paramedical people, we have been into this pandemic right from the start of March 2020. We have been into it for more than 1.5 years. Without any leave or any vacation. So in addition to having been in mask for longer period of times, so it's not only the hospital infrastructure which needs to go up for these sicker patients. It is the healthcare worker also, who needs to know that these gadgets need to be manned by personnel who are very trained and able to take care of these sicker patients.
It really does seem like an impossible situation to reach any sort of answers with the sorts of medical and ethical dilemmas you're facing. I know you've had COVID yourself, and there are people around the world, including here in Australia, who are reluctant to get vaccinated or are cautious about certain vaccines. Are you seeing similar hesitancy in India? And what do you say to those people who are reluctant?
Definitely, we see the vaccine hesitancy in people in India as well. And these people are not lay people only. There are groups of doctors who think the vaccination might not help them, especially the younger lot. I think we need to, educate the people that it's not only the prevention of a particular disease which is important. It is actually the severity of disease which is brought down by the help of vaccination. In the past also, we have seen that influenza, it doesn't prevent having influenza. The disease per se every year, but it is the severity which goes down, and the ICU admissions are brought down drastically if you have had your influenza vaccinations. Same can be true for COVID-19. I mean, it will give you a mild disease post your vaccination, or it might give you a mild disease, but the severe disease will definitely be prevented. In addition, I want to reiterate the fact that we are vaccinating people at the moment, and the immunity might take some time to come in their bodies. It will be, should be reassessed at a period of, I think, 90 days to 6 months and 1 year. And we are short of the data at the moment about this particular fact. We need to follow up the vaccinees for a period of 1 to 2 years and see how longer they are carrying the immunity for particular disease. So there are some knowledge gaps which are there at the moment, but in the shorter term, I think people should know that the severity of disease is prevented.
Dr. Vinnie Kantru there. In developing news, 3 new Australian cases of a rare blood clotting syndrome have been detected and are considered likely to be linked to AstraZeneca's COVID-19 vaccine. The Therapeutic Goods Administration says the cases were in a 35-year-old woman in New South Wales, a 49-year-old man in Queensland and an 80-year-old man from Victoria. The TGA has confirmed all 3 are clinically stable and responded well to treatment, and they're recovering. That is the show for this week. Join us anytime on iView. Thanks for your company. Bye for now.